Welcome to Education Today. I'm Ariana Perella of Armstrong High School in the Armstrong School District. Today we will feature an organization that works hard to help serve communities, not only here but across multiple counties. This organization does many things for the surrounding communities, as well as ours, and brings together many people from many walks of life to try and help those communities and school districts become aware of alcohol and drug use, as well as ways to combat issues related to the uses of those items. Tonight, we have brought in a member of this group to discuss the various initiatives that they put together each year to tell us what this group is all about. Welcome to Education Today. Could you please introduce yourself for our viewers and tell us your role with this organization and what organization you work with?
Sure. I'm Carrie Bentz. I'm the Deputy Director of the Armstrong Indiana Clarion Drug and Alcohol Commission. The Drug and Alcohol Commission is the single county authority for drug and alcohol prevention, intervention, treatment, case management, and recovery support services. So we provide those services in all three of our counties. We do that through funding that we get through the Department of Drug and Alcohol Programs and also through a lot of other grant funding. We are a nonprofit 501c3, so we can write for a lot of grants to cover a lot of initiatives in our counties.
All right. So what exactly is the Drug and Alcohol Commission?
Like I said, we're the single county authority, so we provide prevention. I oversee our prevention department. We do evidence-based drug and alcohol curriculum in grades K through 12 in school districts in all three of our counties. We provide case management services. So anyone that has a drug and alcohol addiction that needs to get into treatment can be seen by one of our case managers. They can have a screening and an assessment, and then a level of treatment is determined by our case managers, and they follow them through the whole treatment process. We have certified recovery specialists that work with people as well to stay with their recovery and stay sober as well. We help connect people to a lot of resources in the community so that people that are have a substance use disorder, that they can get connected with services like transportation, childcare, resume building, things like that.
Yeah, that's great. When and how did this organization start?
So we've been in service for over 20 years, and it started through the Department of Drug and Alcohol Programs. Each county in the state of Pennsylvania has a single county authority. Every county is a little different in the way that they're set up. Like I said, we're a nonprofit 501c3, and we're what's considered a joinder because we cover 3 counties. But every county does have a single county authority.
All right. There's been an ongoing initiative for several years now called the Drug-Free Communities Coalition. Can you tell us what that is and when it got started?
Sure. So about 10 years ago, we were funded through a grant through the Substance Abuse Mental Health Services Administration, SAMHSA, for a Drug-Free Communities grant, and it covered Armstrong and Indiana counties. So we already had a coalition in place, and we just expanded that coalition once we got funding through SAMHSA. It, like I said, covers Armstrong and Indiana counties, and the whole premise of the grant was to reduce youth substance use. So we do a lot of initiatives throughout our counties in order to address that.
Okay. What, if any, differences are there between the commission and the coalition?
Okay, so the biggest difference is the commission is the funding agent for the coalition. Our grant funds specifically for the Drug-Free Communities Coalition did come to an end here in September of 2018, but the commission itself has other grant funding that we use to source the initiatives that we do around the coalition.
Yeah. So the coalition has monthly meetings. What or who makes up the meetings?
So yeah, we have monthly meetings. We are changing the format of that coming the new year for 2019. So definitely check with us before you just arrive or try to arrive for a meeting.
Yeah.
But people that come to those meetings can be anybody from the public, parents, Sometimes we have youth come, but we do it through the schools. Also, any key leaders in the community, so our district attorney is involved in all 3 of our counties. We have people in prevention, we have people in treatment that come to our meetings, we have people in recovery that come to our meetings. Just anybody that wants to be involved. We also work with law enforcement, so we have law enforcement entities that come to our meetings as well. Faith-based community, they're highly active in our coalitions and in our communities. So,
All right. What service do the coalition provide?
okay, so we do a lot of environmental prevention, which is different from like individual prevention. Individual would be, us coming into a classroom and doing a program, where environmental is covering the county as a whole. So things like prescription drug take-backs. We work with law enforcement to do take-back initiatives. We do trainings and education on safe drug disposal. We bring in speakers to our coalition meetings, usually on a monthly basis, to train the coalition on a specific topic so that they can then go out into wherever they work or their communities and kind of help spread the word.
Yeah. What communities does the group serve, and how do you keep up with so many areas across a large geographical area?
Yeah, so it does cover all 3 counties. One of the ways that we kind of break it down is each county does have a separate coalition. So there's a meeting in Indiana, there's a meeting in Armstrong, and there's a meeting in Clarion County. We have just come to the realization that every county is very different. Not only the way their local government is set up, but just the needs of the county. Where Indiana County might have more of a heroin prescription drug problem, Clarion County is battling more of a meth problem. So we try to use our prevention data, the data that we get from the Pennsylvania Youth Survey as well, and kind of break down what the targeted needs are.
All right. Last year, the commission decided to add meeting dates and locations to their monthly schedule. Why was this done, and what benefit did it serve?
So previously, Armstrong and Indiana County used to meet together at one meeting at a central location in between the counties, but we chose to break those meetings apart. Like I had just mentioned, every county is a little different in their makeup and their targeted needs, so we just wanted to make sure we were getting the right people at the table.
I know there's some federal funding involved. What kind of requirements or restrictions come along with that?
Like I said, our federal funding for the grant did come to an end here in September. We do have, though, some other fundings through the state and through federal government. With any of the grants that we have, there's always restrictions. When you submit a grant proposal, you have to follow your strategic plan and what you are and are not allowed to spend in certain line items. So, it just kind of depends what the grant focus is, and, also we have to make sure that we're producing outcomes for those grant initiatives as well.
Yeah. How do ideas get their start?
Well, we don't just make them up. We do use our data and evaluation for our counties. Like I said, our Pennsylvania Youth Survey. We also look at our treatment data. We look at our hospital level data. We do a needs assessment of our counties. Other organizations do needs assessment as well. Our county hospitals do needs assessment. And we just really look at where our targeted needs are and where we need to focus our efforts. And then that's where we apply our funding.
So it's like more generally the community rather than like the federal government.
True, yes.
Okay. When is it decided to move forward with an initiative? Do you try to implement it in all areas, or is it just certain ones?
We try to do things across the board in each county. There are, certain counties that have more specific needs than other counties. As far as, like I said, there's more of a meth problem in Clarion right now, so we are targeting more of our efforts there. So we just kind of, again, look at our data, look at our evaluation, assess our needs, and then come up with a strategic plan to address that and identify, what other organizations we can bring in to help us address those needs.
So how are those areas determined?
Again, by our data, like I said, our Pennsylvania Youth Survey, we can see, especially if we're talking schools, we can see maybe that one county has more of a need, maybe kids are reporting a higher use of alcohol. So we want to make sure that we're getting into those school districts and we're doing more programs based around alcohol. And we have those conversations with school administration about the data and what we would recommend for their school district.
In what ways can someone get in contact with the coalition?
So we have a Facebook page. It is Armstrong, Indiana Drug-Free Communities. So you could send us a message through our Facebook page, or you could like our Facebook page and get involved. We put all of our meetings, dates, times, locations through the Facebook page, and then any other trainings that we have. We have a lot of community trainings. The Student Assistance Program is run through our agency to the drug and alcohol portion of that. We just had a training last Friday for teachers and other, human service agencies in the community, so they could, get more training around drug trends, what they're seeing out in their community. There's also a need for some grief support for the schools and trauma, depression, suicide. We know that those are higher in our area, so we want to make sure the teachers are getting the trainings that they need in those areas.
Okay, thank you very much. We're going to take a short break, and we'll be right back with the Armstrong School District's Education Today.
Success. We see it every day. Hundreds of majors and programs, bachelor's degrees to PhDs, small classes, internationally known faculty who are committed to your success. Real-world experiences to guide you on your career and life path. An alumni network 120,000 strong. I'm IUP President Mike Driscoll. Visit us. Find your success at Indiana University of Pennsylvania.
It's hard to explain. It just became home. There are hundreds of majors and programs, bachelor's degrees to PhDs, small classes and faculty that really get to know you. Amazing internships and everywhere, programs that help to find a job that is right for you. It's what IUP is about, a commitment to your success. See it for yourself. Visit us, Indiana University of Pennsylvania. Find your success.
Welcome back to Armstrong School District's Education Today. Tonight we are talking with Ms. Carrie Benz, a crucial piece to the Armstrong, Indiana Clarion Drug and Alcohol Commission. Let's start to talk about some more specifics in what the organization does.
Okay, so if we're talking about prevention, we do have a prevention guide that goes out to the schools at the end of every year so that they can decide what they want to do when it comes to the next school year. So in the school districts, they've been mandated to provide opioid education. So some of the new programs that we've provided this year, along with some of the programs we've been providing, we do evidence-based curriculum. It's called Too Good for Drugs and Too Good for Drugs High School. And that curriculum, it starts as early as kindergarten. And a big piece of the curriculum in the very beginning is to build character, resiliency skills, teaching kids how to say no, talking to them about peer pressure. And then as the curriculum evolves into the older grades, we get into the more specific drugs, tobacco, alcohol, marijuana, and teaching kids, what exactly the drugs do to your body, giving them the facts, not using scare tactics, because we know that kids do not respond to scare tactics. Just really teaching them, how these drugs interact with your body and why they are dangerous.
Okay. I know that the Commission and DFC are based in Armstrong County, but do you work with any other groups in any other counties?
Yeah, so we do work with Indiana County, and Indiana County has a coalition, and we do work with Clarion County, and they have a coalition as well. Each of the 3 counties also has an overdose task force in light of the opioid epidemic back in 2014-15. We had formed overdose task forces with the leadership of our county coroners. And we really worked on getting the data for our counties on how many overdose deaths each county was experiencing. People going to the hospitals through the emergency department, seeking treatment for a substance use disorder. Also working with our local emergency medical services, our EMS, and getting their data as far as how many calls they were going to for overdoses. If people were getting on the ambulance and going to the hospitals, if they may have received Narcan, which is an overdose reversal drug. So just really getting those statistics and then building a strategic plan. We also work with the University of Pittsburgh, and we work with Indiana University of Pennsylvania and also Clarion University on gathering all of that data to really hone in our needs in those areas.
Yeah. Another big initiative every year is the Youth Leadership Conference. What are some details that you can tell us about that?
Okay, so Youth Leadership Conference is coming up February 20th, so save the date. That conference is funded through our gambling prevention dollars that we get through the state. So we do have a speaker lined up to do some gambling education and more focused on gaming and esports and fantasy football, the things that kids take a part in. Also talking a lot about the game Fortnite that kids play and how that can have a role in some gambling behaviors and what we need to be on the lookout for. So just really providing kids with that education that they can take back to their schools and share with the student body as a whole. We're also looking into some other speakers to come in and talk about suicide prevention, just how to take care of yourselves, wellness overall. I know we always put surveys out at the end of every conference and ask the students what they want to hear for the next year. So we try to focus on those as well, of what information they really want to get, so that they can take back to their schools. A lot of times schools ask us, well, what do I do if a friend needs help, and where can I go, and where can I send them? So we like to provide all that information to them.
So where is it at?
Oh, it is at the Hadley Union Building on the IUP campus. So all schools in Armstrong School District and all schools in Indiana School District are allowed to send at least 10 students to the conference. It's a full day conference, and we usually get a lot of involvement from the schools, and the kids seem to like it, and they go home with some free goodies as well.
Yeah, that's good. Why is this an important event for the youth of our communities? What kind of feedback do you get? You said the kids like it.
Yeah, so it's really important that we educate the youth and put resources and knowledge in their hands. I mean, they are the future leaders of our communities, so we want to make sure that they're healthy and that they're able to have that knowledge to share with their friends and the student body as a whole. We just want to build leadership skills in them. We want them to know what's going on in their communities. Sometimes it's a way too, because we invite key leaders from the coalition to attend as well and just participate and interact with the students. So at the conferences, the district attorneys could be there, the sheriff's department could be there, state police, just some of those key leaders in the community that the students can interact with and build and form relationships with, and also use as a resource as well.
Still another big program is the reality tour. Can you tell us about that?
Sure. So the reality tour is currently done at the Indiana County Jail. It is a program for parent and child or guardian and child to attend together. It's to start the conversation about drugs and alcohol. It's not meant to be a scare tactic, even though it's at a jail setting, but it's truly supposed to give like a real life scenario of what could happen. And the hope is that, we provide resources as well to the parents and to the youth. So, once they come back together, they're in the car on the way home, that a parent is able to open up and they're equipped better to ask their kids, so what are you seeing? Have you ever heard of this? What would you do in this situation? And kind of building a plan between the guardian and the child if the child was ever faced with being asked to use drugs or in a situation that they couldn't get out of.
Okay. How can someone get information about signing up and attending these events?
So you can go to our website. It is, if you Google Armstrong, Indiana Clarion, we should come up, but it is under AIDAC.org is our website. Like I said, we also have a Facebook page, Armstrong, Indiana, Drug-Free Communities. Clarion has a Facebook page as well. It's Clarion Drug-Free Communities. We have an office in Chillicothe is our main office. Our phone number there is 724-354-2746. So you could call our office as well, and we can connect you with all kinds of services and lead you in the right direction.
So can you bring like groups to the events or families?
Mm-hmm. So for the reality tour, you could bring your whole family. You could bring a group. We have had to, say, a coach bring his team, or a SAD club bring the whole club, just as long as we have parent permission for that adult to act as kind of like the parental role for all the youth coming to the event. So that's also a good way too for a coach to kind of set boundaries with his team or her team and say, these are the expectations and these are our policies, and, start that conversation about drugs and alcohol as well.
That's good. Why is this program important?
If we're talking specifically about the reality tour, it's important just because it's offering that education. There is, it's kind of like a little play that people see. It also brings in volunteers. So, it's just really important to start that conversation as early as you can. We have data that shows us that the early age of drug use can be as young as 10 years old.
Wow. The coalition also collects data from the counties it serves. How is this data collected and presented?
So a lot of times we're in the middle right now of doing a needs assessment, a prevention needs assessment for the county. We also do a treatment needs assessment, and it's gathered from, like I mentioned before, the hospitals, the ERs, the law enforcement. We get law enforcement data. We get data from the Pennsylvania Youth Survey. So we kind of combine all that data together and put it in a report format. Of course, we report it out to the state, but it is also available for our local, county commissioners. We're governed by a board of directors, so we provide that to them as well. And we report out on our data at our coalition meetings too.
Before we go, are there any other programs that you want to talk or mention?
Not really just programs, but just some of the drug trends that we're seeing with youth. Vaping has become a real issue with youth, especially the schools. They're finding the vape pens and the Juuls, and it's not Jewel, it's Juul. If you don't know what those are, I just suggest and recommend, especially to parents, that they educate themselves on what these products really are, and how, breathing in the different e-liquids and e-juices, and I feel like, if you don't know what I'm talking about, you might be like, I don't know what that is, but that you really educate yourself on what it is. A lot of the vaping products, they're run by our big tobacco companies that make cigarettes and chewing tobacco, and we all know, that cigarettes can cause cancer and other health problems, and I just feel that the youth of today are kind of the guinea pigs for these products. And we don't know, and we don't have enough research and data on where these products are going to be 5 to 10 years from now, and what kind of health effects it's going to cause in our kids 5 to 10 years from now. And I know that there's a lot of hype on social media about the different vaping products, and how big you can make your vape cloud and things like that, and how social media plays a role in drug and alcohol use as well. But I just really want kids to be smart and educate themselves about these products and the different things that they can do to your body.
Yeah. Can you mention again how people can get into contact with you guys?
Sure, so they can visit our website. You can Google us at Armstrong Indiana Clarion Drug and Alcohol Commission, or our actual website is aidac.org. You could also call our office at 724-354-2746. And we also have a Facebook page. It's Armstrong Indiana Drug-Free Communities. And we have a Twitter account as well. It's connected to our Facebook page, so you can find us that way too.
Okay. Is there anything else you'd like to add for the benefit of our viewers?
No, I just encourage everybody to take advantage of any of the educational programming that we have available in the community. I know sometimes it's hard in the evenings to get out there and take advantage of these things, but please do so and educate yourself on drug and alcohol prevention.
All right. Well, that's our show for today. I'd like to thank our guest, Carrie Bentz of the Armstrong Indiana Clarion Drug and Alcohol Commission, for taking time to join us tonight. Our thanks also go to the TV production students of Armstrong High School, led by their teacher, Mr. Don Swanson. They were our film crew today. Please join us again next week for another look at the Armstrong School District. DVD copies of this and all Education Today programming can be requested by contacting Chris Garetano, Multimedia Technician at the Armstrong Junior Senior High School. Visit our website for updated information about the district, and have a great week.